Hi, my name is Dr Tan. I've been practicing as a medical doctor since 1997. Graduated from School of Medicine, University of Malaya that year. As to why I ended up in this field, I must say that there's a combination of two factors. One, I would say fate, as in FATE, and secondly, I would say, of course, interest. I would say my daily routine would not differ very much from what the other doctors' daily routine would be. I think essentially it centers around trying to solve patients' complaints, the problems. So you have patients coming to see us, and then we ask them questions about their complaints, examine them, and from the history-taking examination, we'll come up with list of possible diagnosis, discuss what may need to be done investigations-wise, how much does it cost, what it entails, the pros and cons, if there's any risk involved in the investigations. After which, when the diagnosis is actually certain, with the differential diagnosis excluded and complications of suspected disease, confirmed or excluded, then we'll strategize treatment plans, and of course sometimes there are more than one treatment plans, and we discuss about pros and cons of each, how much does it cost. I would say, hardships are part and parcel of human life. It's nothing specific to, what line of work you are in. But I would say, as doctors, I would say that I would categorize hardships into, probably at least two, as in physical hardships, psychological stress, financial, may not be. Physical stress, as in, it could be taxing, or work could be taxing, long hours, and especially when you're on call, and after post-call, you may have to continue working as per normal, I would say that psychological stress comes especially when you deal with emotions of patients, emotions of family members, and especially if dealing with a potentially life-threatening conditions, and especially so when the condition do not improve, despite giving your level best and that you could give, whether in the local setting or even by international standards, but the patient's condition still deteriorate, in which case it could be very, very stressful, not just for the family members, but as a caregiver as well. Before really you decide to take up medicine, there are a few questions you might want to ask yourself to establish whether is this career really suitable. And I think one of the few important questions I think would be like, whether how important is sleep to you? How important is having a free weekend to do what you want to do? How important is having able to spend as much time as you want with your family members? And is it really important that you get rich at one point in time later? After maybe 10, 20 years into practice. So if your answer is yes to any of these questions, then you might want to reconsider the option. And also, in terms of what is required to be a doctor, I would say that, try to be a good one. In order to be a good one, you don't need to be really smart, as in you don't really need to have the mind and the brains of a rocket scientist or someone like Albert Einstein, Professor Stephen Hawking. But you need to be someone who is fairly rational, as to how you solve problems, and you're reasonable, and communication is actually very, very important, and empathy is important as well. It's a combination of yes and no to your question. Yes, because I'm not able to control and do what I want to do with my time, but on the other hand, it's largely, this feeling of regret is largely negated. With the very gratifying feeling when you see your patients recover under your care.